outbreak of the COVID-19 in Qingdao, based on the requirement of the central government and local government, we have established the working mechanism by mobilizing all available resources to fight against COVID-19. In order to give you the updated information, we invited the following guests. Vice Mayor Mr. Xu Ruwen, also the head of the public security, Mr. Chen Wensheng from the General Office of the People's Government, and also Mr. Zhao Guolei from the Municipal Health Commission, and we also have Mr. Jiang Fachun from the Municipal CDC. These four guests will give you the updated information and also take some of your questions. First of all, give the floor to Mr. Sui. Friends from the media, good afternoon. Welcome to today's second press conference. This time, a sudden outbreak in Qingdao. We work together with residents in Qingdao. We actually spent a lot of efforts, and also would like to take this opportunity to say a big thank you to all the people involved. Now I would like to give you the updated information regarding the outbreak prevention and control. First, regarding the general progress, since the outbreak of the COVID-19 in Qingdao, we have spared no efforts in treating patients, tracing close contacts, conducting sweeping NAT, managing the key areas. The detailed information already released and introduced to you in the previous press conference, so I will not go into details. And on top of that, we also have done the following works. First, we focus on the prevention work in community level as well as villages. So we mobilize the residents in these areas to respond to the calls regarding a massive scale of NAT, make sure no one left behind. And also at the same time, we also implemented the measures in place, and also organize the groups in the community levels and villages to make sure we can organize and establish the grouped and also the carpet-styled management. And second, regarding the key areas, regarding schools, hospitals, the nursing homes, as well as the prisons, the prevention work should be done in there, as well as the supermarket, the food market, and also the large entertainment space should also focus on the prevention work. For the supermarket, we actually 100% prohibited the trading of wild animals, and also we conducted the disinfection work for people entering to the supermarket. They should take their body temperature measured, and also the hygiene work should be carried out every day. At the entrance of a supermarket, we should have the inspection pots, and also make sure that the people wearing masks. And for the key transportation stations, such as airports and train stations, we also have the pledges and the measures in place. Make sure that at the route of the transportation, the centralization and logistics should all have the measures. And we also should focus on the closed cycle management and force in regarding the transportation and logistics of food, and also under our monitoring. Second, regarding the treatment. So based on this morning's press conference, as we already know that a certain confirmed COVID-19 patients with the guidance given by the central and the municipal expert team right now have received the treatment in the designated hospitals. So far, they have maintained a good condition. I will not go into details. And third, regarding the massive scale NAT, as of 15:30 today, 10.46 million already tested, and 8.84 million already show the result. Besides the 13 confirmed cases, so far no new positive cases have been found. At the community level, so 10.24 million people at the community level already finished the testing, and 6.8 million people already received the results, all negative results. For Shinan, Shibei, Lichang, Laoshan, and Chengyang, these 5 key areas in Qingdao have generally finished all resident NAT with negative results showed. For the other 5 areas, so far we have collected samples totaled 5.89 million samples, accounting for 84.3% of the total target. So this is actually based on our schedule of we should finish all the samples collected in 5 days. So right now, the 4.28 million samples already showed results, all negative. This time, we also sent 8 expert teams from the infectious disease department, from the infectious disease, the ICUs, and the TCM, and the pulmonary department. And we also sent the 6 experts, 3 nursing experts with rich experience in treating TB patients to the hospitals to give additional care. In order to hit the target of conducting sweeping NAT as scheduled, we also received great help from the other cities. In Shandong hospitals and the 2nd affiliated hospital, and 3 Health Commission affiliated hospitals, and also hospitals from Yantai, Jining, Dongning, Rizhao, Zibo, Weihai, Linyi, Binzhou, Weifang, and Heze have dispatched more than 1,200 people regarding NAT and sample selection. Longnan County in Gansu Province, that's also a part of a city and county for poverty alleviation. They also organized a medical expert team totaling 50 people to Chengyang city in Qingdao to conduct the NAT work. That also gives us additional confidence, and it's very encouraging for us to win the battle against COVID-19. Going forward, we will do everything we can to do our work in a solid and a sound manner, always put the people's health and safety as our top priority, and we should tighten our mindset. And we should also give a special focus on the treatment, epidemiological investigation, the testings, as well as infection work in key areas. And we should identify the source of transmission as early as possible, and also mobilize and integrate the available resources. And for Jiaozhou, Jimo, Xinhai, new area, Laixi, these 5 other areas in Qingdao, they should finish their NAT tomorrow, which is the 5-day goal as scheduled. We also would like our media to help us to promote the information and also get the public to protect themselves, such as wearing masks, keep social distancing, keep their hand hygiene, and keep ventilation, and also buy the necessary medical supplies. And also for the hospitals, we also have the work to make sure that we're prepared for the worst scenario. Thank you. Thank you, Mr. Xue. Now the floor is open. Please identify your media affiliation before raising questions.
各位领导好，我是齐鲁晚报的记者，我想请问，青岛是否应该制定更加详细的管控措施，来避免此次情况的再发生？谢谢。
Whether it's necessary for Qingdao to have even more concrete measures in place. Thank you for your question. I would like to invite Mr. Zhao to take your question. Thank you.
疫情啊，对我们青岛来说啊，是一个非常沉痛的教训。疫情发生后啊，
outbreak actually also a big lesson for us. Since the outbreak of the COVID-19 in Qingdao, the central and municipal government, as well as our neighboring cities, give us great support that actually make us possible in a very short time period, finished these large-scale NAT endeavors. Lesson learned. Therefore, we have stipulated and also introduced stricter measures, including the following areas. First, we emphasize on the quarantine practice. For the close contacts and close contacts of close contacts, general contacts, the relevant people in identified occupation, they should also follow that quarantine practice in order to make sure we curb the spread of the virus. Second, we also focus on the nosocomial infectious management, especially the measures going on in the designated hospitals, that everything should practice in line of the infectious disease hospital standards. And also regarding the in-hospital management, we also have organized the capability building endeavor covering the fever clinic, NAT treatment, and also the normalized disease prevention and control in fall and winter seasons. And fourth, we also conduct a sweeping screening work. So we have conducted great management style to find out the potential risks and problems. And fifth, we also conducted specific inspection work. The municipal health commission also has dispatched a specific team to work in this regard. Regarding the triage, the fever clinic, and also the treatment in the hospitals, they should basically receive these kind of inspections. So by finding the problems, also give them the requirements, and also ask them to correct their wrongdoings in a certain time period, and we will recheck the result. By doing so, we actually have that capability to manage and contain the virus. Thank you.
大家好，我是半岛都市报的记者。我特别想问，就是这一次疫情是否影响青岛人的正常生活？
So my question is whether the outbreak impacted the Qingdao people's normal daily life. So the people that they would like to pay a business trip to Qingdao, they can actually as normal practice to entering and leaving Qingdao with a peninsula metropolitan daily. I believe this is a lot of people really like to know the answer. Now I would like to invite Chen Wancheng to give you an answer. I believe this is actually not only concerned by the residents in Qingdao. And also the people who pay a visit to Qingdao also would like to know the information. Based on the requirement of a normalized disease prevention and control, we have done the following. First, for the residents, protect yourself well. So under this circumstance, you can go to work, go to school, just your daily normal activities. For the catering sector, supermarket, agricultural market actually all operate in a normal fashion. So nothing actually was impacted. So people can conduct shopping or eating outside, but for sure you need to protect yourself. I believe nothing really changed in people's daily life. For Qingdao residents, besides people living in the medium risk areas, they can conduct their normal daily activities. And we also would like to say, if not necessary, please do not leave Qingdao. If you have to, please bring the valid NAT certificate. At the same time, we also would like to call on everyone to be cooperative to your destination's city regarding their disease prevention and control measures, and also conduct less public gathering. And also, as we're saying, that please wear masks, keep your hand hygiene, keep ventilation, and also keep social distancing. If you show symptoms such as a fever, first of all, protect yourself, and second, do not take public transportation, and third, please report yourself to the nearest fever clinic. From the October 12th, we have been conducting a large-scale NAT in Qingdao. Especially in the 5 key districts in Qingdao that already finished the NAT and already have the preliminary results with no new positive results shown. Without the early identified medium risk community, for the rest communities so far are safe. So the order of work and daily life actually are well guaranteed and in a good manner. Nothing really impacted or changed. And after the outbreak broke out in Qingdao, we also noticed that the other cities have taken some measures for people from Qingdao. It's totally understandable. And also we would like to say that we not encourage people to conduct unnecessary trips outside Qingdao on behalf of 11 million residents and the migrant populations in Qingdao. We would also like to say that please give the understanding and support to people from Qingdao. I would like to add some comments. So far, the order of economic and social activities actually are normal. Regarding schools, the public transportation stations, ports, working places actually are all operated in a normal fashion. Based on the results we got so far, actually all showed negative results. Till tomorrow, we will finish the whole population NAT. So as we said, that people in Qingdao is better not leave Qingdao. So I also would like to call on everyone's understanding that because in the recent days we still need to do the testing work. But so far, the virus in Qingdao is controllable and manageable. For the other areas beside the middle level community, nothing actually were impacted or changed.
各位领导，下午好，我是工人日报的记者。天气的转凉，然后咱们医院呢现在也进入了一个就诊的高发期。那现在这个时期，我们如果身体出现不适，建不建议到我们的医院就诊？
And also, it's the peak season for people going to the hospital because of a fever. Is it recommended for people to go to the hospitals if they show the fever symptoms? I may invite Mr. Jiang to take your question. Right now is the season changing from fall to winter. It may show the symptoms such as a fever, and it's the best choice. Actually, please visit the hospitals for treatment. As long as you protect yourself and show the health code in the hospitals, make sure your temperature measured, keep social distancing, it can have a really less chance to be infected. And we also have online medical services available, and more than 30 hospitals actually provide this kind of service, and it's actually facilitate people's medical requirements. If actually you not feel quite well, please protect yourself by wearing PPEs and pay a visit to the hospital. Thank you.
你好，我是山东广播电视台的记者，我想接着江主任的那个话题往下问哈，就是您刚才提到很多医院都开通了这个互联网。A
follow-up question. As you mentioned, actually, we have that online medical service available. Would you please give us more information on what is the access for the public to get these kind of services? Is go to a third-party platform or to each hospital's platform? So maybe Mr. Zhao is the right person to answer your question. So for the Health Commission actually approved 30 networking hospitals or the internet hospitals. So for these kind of services, actually including 3 forms. One is the online consulting service. So they can give you some suggestion based on the symptoms you described, but it's not the treatment or diagnosis. Second, the patient need to first do the pre-diagnosis in the physical hospitals, and then the person is capable to receive that online diagnosis. So based on the pre-diagnosis evidence, plus the changes happened in their symptoms, in their body conditions, then the doctors online can give the diagnosis suggestions. And prescriptions actually also can be paid online, or the prescriptions also can be given by the doctor online, and also the patients can buy all these medicines at the nearby drugstores. And third, and also you can book appointments. So that for the registration, you can know exactly what time you need to go to the hospital to receive the diagnosis. Of course, all these actually is some basic services provided by the network hospitals going forward with the advancement of the high-tech equipment and technology such as wearable equipment. I believe there are diverse services available and provided to our public. Thank you.
你好，我是鲁网的记者，我想问一下，现在青岛这种情况是否影响相关资格考试的进行？谢谢。
Thank you. My work is that based on the current situation in Qingdao, whether that impact the certificate tests to be held in Qingdao, such as the legal tests. I would like to invite the Chen Wansheng to give you the answer. So regarding the exams at the national skill professional exams, at the accountants and the exams and also the designers on tax, the auditors. We also organize a specific team to give the approval, so it's a green light to all these exams. According to the exam venue arrangement, that the people from Qingdao, they can receive the test in Qingdao. But actually, the people they're not in Qingdao but applied exams to be held in Qingdao, then they will be rearranged. For the universities, right now also conducted closed-door management, so students are not allowed to leave the schools, and if people need to enter into the schools, they also need to show the required certificates. For these kind of exam venues, actually, we know they have faced some difficulties, but we will do everything we can to prevail over the difficulties, make sure that all the measures actually are implemented in place, and we also have a medical personnel to help us regarding emergency response in the exam venues. So the people going to take these exams, please take your health code and also the required certificate. And NAT actually is not a must, but if you show the symptoms such as fever before the exam day, or you have the travel history to overseas destinations 14 days prior to the exam day, and you need to have your NAT results.
各位领导好，我是青岛信网的记者，想问一下，今天健康码开始显示身份证号码，是否意味着检测结果出来了，可以凭此码外出？
So today the health code actually also showed people's ID numbers. Does that mean that the NAT result already available?
好，谢谢这位记者朋友。
So I invite Mr.
那
Zhao
么
to
这个
help.
健康码呢，
Thank you
它
for
这
your
个全
question.
名啊叫电子健康通行码啊，是我们省委啊统筹。
So the health code actually a electric
这个指导要求下
green
开发
light.
的用于疫情精准防控的一个信息系统。
So this is designated for the targeted disease prevention and
大
control.
多数这个公共场所、办公场所、居民小区
In Qingdao, the majority of the working space, community,
都全面
the
的
public transportation,
那么这个系统
and the public areas actually all applied this system.
那么它一开始的主要功能呢，主要是几个方面，一是本地的居民呢。
The purpose of develop this kind of tool
还有一个呢，是我们境外
actually is basically to show your health condition,
返鲁人员
and for people from other places or other countries to Shandong province, they also can apply to use this health code. For elderly people or children,
一个模块呢，代为出示或者打
the family members also can
那么市民在
have their health code printed, or the family member can also help them to show the green code on their appliance.
通常情况下就可以显示这个核酸的检测结果。这个系统开发出来之后啊，它的功能它是不断的在完善之中。一开始呢，它首先呢增加了。
So regarding the functions of this system, actually is improving. At the very beginning, it just showed the time of that the green light validation. Yesterday, one more function available, which was the ID number. So if you click the health code at the bottom, you can find that the ID number with a certain number hidden. If you click the ID number, then it will show you the full information of your ID. So by doing so, it helps to show whether that health code is the person, the same person that applied for the system. Actually, this function not really directly linked to the NAT. So if our residents, if we already tested, please be patient. Right now we have organized all available resources to accelerate the upload of the NAT results. Not long, we will receive the final results of NAT.
您好，我是中央广播电视总台 CGTN 的记者。就是我们可以看到全员核酸检测已经接近
CGTN.
所以我想知道
So we can see that right now is coming to the end of the city-wide NAT endeavor. So what's the feedback from the expert team? And for the momentum of the outbreak, what's our decision regarding this question? Now I would like to invite Mr. Jiang to give you an answer. Based on the evidence showed by the epidemiological investigation as well as citywide NAT results, right now we can give a preliminary judgment. And this time, that we have less and less. The evidence showed that the outbreak actually triggered from the community level, and actually we still need to wait more evidence from the epidemiological investigation, the final result of the citywide NAT, and also the testing results from the hospitals and the testing stations, and we will give you the final answer and decision based on all these evidence.
各位领导好，我是中国民生新闻网的记者。我想问一下，目前就是全民检测是口咽拭子，这与医院各的鼻咽拭子有哪些不同？听说鼻咽拭子准确率更高，是这么回事吗？
So right now the citywide NAT actually conducted the oral or the throat swab. But people saying that actually a nasal swab maybe have a more accurate results. So we talk about COVID-19 actually show the evidence or the symptoms first at your throat. So that is why we conduct a throat swab, and also we can find a virus at people's palm. So as you mentioned, so no matter it's a nasal swab or the throat swab, the key thing is that whether people conduct all these sample collection, follow the standard process, because that will impact the final results, or that basically will identify the quality of the testing. So if that everything conducted followed the rules, actually no matter it's a nasal one or the throat one, no difference. So why we choose throat swabs? Basically based on the operation of kids, actually throat swab actually is easier to operate. But think about this large number of a population, that is not really safety to do so. So that is why, for the massive number of the NAT, we choose the throat swab. And this is the end of the Q&A session. I also would like to thank you all the friends from the media for your cooperation and also give us your interested questions to us, and we also transferred your questions to our experts. And also through the press conference, we would like to release the information that people are keen to know. And for more information, so we will also release from our press conference, and also will release the updated information on our official website. And please also protect yourself well, our friends from the media. And for the more information, please follow the official accounts. And this is the end of the press conference. Thank you all. Thank you, friends from the media.